Hello, my name is Justin Baker. I am the Chief of the Division of Quality of Life and Pediatric Palliative Care at Stanford University in Palo Alto, California. It is such an honor to be here. My love, my passion is pediatric palliative care. Many people know me actually as the Chief Koala Bear. Koala is Q-O-L-A, quality of life for all, because that's how I define pediatric palliative care. Quality of life is defined by each person differently. My job is to help them figure out how can we make every day the best day possible, and then we put that into action. I also know that what matters most is that every moment matters. That's what palliative care is all about. It's making sure that we address suffering and promote quality of life and make sure that every single day is the best day possible. And when I think about the suffering of these precious children and their families, when I think about all the different ways that they are having a difficult time, I imagine how they might be suffering physically and having physical symptoms. They may be having a difficult time emotionally and struggling to have happiness and joy. They may be struggling within their family and within their friends or socially. They may also even be wondering, why is this happening to me? Or having a difficult time existentially. And so we in pediatric palliative care have to think about all of these different issues. In fact, I'm also an oncologist, and the disease I treat as an oncologist is cancer. The disease I treat as a palliative care doctor is suffering. I think some of the aspects of that are absolutely essential are things like, how do we take great care of the children while they're at home? How do we make sure that if home is becoming difficult, how can we move them into the hospital setting and take wonderful care of them there? And then how do we take care of them in a beautiful hospice setting, even though it's such a difficult time at the end of life? How do we surround them with love? How do we surround them with joy? And how do we make sure that during this really difficult time, we are allowing them to die with dignity? That's a very difficult topic, but it's one that is so vitally important. In pediatric palliative care, we work to make every day the best day possible while recognizing that we may not have as many of those days as we would have wished. And what we're all about is making sure that every moment matters. At Stanford, we have a team that takes care of patients in the inpatient setting. We're building an outpatient clinic. We're working with home-based care teams to make sure that we can take care of patients and families in the home-based care setting. And some of the things that we try to make sure that we can do also there is not only provide excellent clinical care, but we also want to make sure that we're always advocating for pediatric palliative care and making sure to be promoting pediatric palliative care both in the legislature as well as in our region and in our community to make sure that there is good public information about pediatric palliative care. We also have the great fortune of doing significant research. We have an endowed research director who is joining us, Dr. Claire Wakefield, and we're so fortunate to be thinking about big questions in the context of pediatric palliative care. Which patients can best benefit from pediatric palliative care? When is the right time to integrate pediatric palliative care? What are the outcomes that matter to families? And how do we best define the field of pediatric palliative care? And finally, we also are trying to make sure that we're promoting education. And when we think about education, we're imagining training the next generation of doctors. We're also wanting to train the next generation of prescribing nurses, social workers, psychologists, chaplains, and we'll be building those educational programs across time. The other thing that we're very excited to be participating in is Epic Pediatrics. And Epic Pediatrics is an educational curriculum where we train a generation, train up the next generation of palliative care providers to be able to teach other people at their hospitals, to be able to teach other care providers how to best integrate palliative care. Boy, this sure is a difficult time in the world. And during these difficult times of division, these difficult times of strife, these difficult times of stress, I think one of the biggest things and themes that I hear about is uncertainty, and how the uncertainty makes things just feel heavy. It's very difficult to imagine all of the different ways that that contributes to stress in all the people seeing this message. But I want to tell you, it impacts children with palliative care needs even more. It impacts their families deeply. And during these times when we can be so stressed and so divided, I want to tell you about a topic that can bring all of us together. And that is working for the benefit of these precious children and their families. What can you do? What can we do to come together to help these families have every day be the best day possible? To make sure that every moment counts. That's something that can unify us. That's something we can come together around. This beautiful place here at Sobótka, here in the community of Prague, how can we come together? We can come together with these precious patients and families at the center, knowing that by doing so we can help them have the best day that they could possibly have, and build a community together around them.